and the motion is agreed to.
The very fact that this new idea is coming forward at the very same day that debate on the bill is beginning, I think is a sign of just how weird and rushed this process has been. The skinny repeal appears to be a sort of last-ditch backup plan. This is definitely McConnell giving it the old college try. He's worked really hard to try to write a bill that he thought he could get to 50 votes. He's really struggled with that, and I think now he's potentially trying again with something that is more modest but potentially has the ability to attract more votes. We don't have any legislative language yet on the skinny repeals, but it looks like what the plan would do is it would repeal Obamacare's individual mandate, which is the requirement that everyone have insurance or pay a tax penalty. It would remove Obamacare's employer mandate, which is a rule that says that employers with more than 50 workers need to provide affordable insurance to their workers or pay a fine. And it would remove a tax that the law created on medical devices. This bill is the most modest in terms of the changes that it would make to current law, but I think that it would have pretty substantial effects. It would probably result in somewhere in the neighborhood of 15 million fewer Americans having health insurance at the end of the decade, premiums increasing by 20% or more compared to what would otherwise happen, and to insurance markets becoming very unstable and uncompetitive in some parts of the market. So these are not trivial policy changes. This strategy seems very clearly focused on trying to get to 50 votes in the Senate. And if you think about the objections that various senators have raised to the other proposals, you can see why this may be something that they could agree on. This would not make any changes to the Medicaid program of note. There have been some concerns from more conservative Republicans that the bill puts too much money into the healthcare system and doesn't really repeal Obamacare. It could be more easily sold to those people as a partial but clean repeal of Obamacare. Senators are not going to have a lot of time to review this provision and really think it through. This very idea of skinny repeal, there is no legislative text, there has been no CBO score. You would imagine that those things will become public before a vote, but the clock is ticking at this point, and the Senate is under a lot of pressure from the president to try to produce some kind of results to follow through on their promises to repeal Obamacare.